Good afternoon and welcome. My name's Tim Poe. I'm Director of Telehealth with the UNC Cancer Network. Thank you so much for being with us today, September 11th, 2019, for our RN and Allied Health Lecture with the UNC Cancer Network and the Lineberger Comprehensive Cancer Center. Just a few things to go over and then we'll meet our guest and get started. Let's see, what can I tell you? Any technical difficulties, call us, 919-445-1000. We can also answer questions. You may also email us, unccn@unc.edu. Our website is unccn.org, and you can find out about past lectures, future lectures. Find our learning portal where you can take up to 24 different lectures are there at any given time that you can watch on your own time, and lots of other things as well. We're on Facebook, Twitter, LinkedIn, other places as well. We will be using Poll Everywhere today. So if this is, if you know the drill, don't worry about this, but if this is the first time you're using Poll Everywhere, there are two different ways you can join us. I think the easiest thing is just to go on any browser, including a browser on a smartphone, to pollev.com, pollev.com/UNCCN. You'll see the, as each question comes up, you'll see it there, and you'll be able to respond to those. And you can also use, if you prefer to use the texting capability on your phone, in the to field, you can type in 22333. In the message field, UNCCN, you'll get a message back saying you've joined, and you can use the texting functions on your phone, so whichever you prefer. Special announcement for this lecture. This lecture is only for CNE, that's the ANCC Continuing Education Credit. Because of the specificity of this lecture, we are only able to offer CNE credit today. So if you showed up today hoping to get ACPE Pharmacy or ASRT credit, I apologize, but we will not have those associated with this lecture. If you're going, oh shucks, I had this hour all set aside for continuing education, please go to our learning portal, learn.unccn.org. As I mentioned a minute ago, 24 courses there. Almost all of those offer both many of them offer the ACPE credit, and just about all of them offer ASRT credit. So lots of courses that you can do today and make good use of your time. Of course, we'd love to have you stay for this, but I don't want to disappoint anyone who is looking for ACPE or ASRT credit. All right. That said, this is what our Poll Everywhere poll will look like. Which of the following are examples of education standards and behaviors for nursing professional development? And A is to develop goals to promote professional development of self. B is participate in identifying and meeting learning needs of self. C is attend education programs based on identified learning needs found by management team. Or D, with assistance, use patient education materials relevant to patient population. Or E, all of the above. We think this might be kind of a softball, but go ahead and we'll put up the actual Poll Everywhere poll in just a moment. And with that, we are very pleased to introduce Claire Gillett. Thank you so much for being with us here today. Yeah. So a little bit about you. You've been a registered nurse since 2010 and employed at UNC Healthcare since 2011. Yes. Great. And worked in both inpatient and outpatient as an oncology nurse. Yes. Most recently functioned as a clinical nurse education specialist in the oncology service line. Yes. Obtained her oncology certification in 2012 as a CNES, assists with face-to-face classes for oncology employees, curriculum development, and onboarding of new employees across the hospital. Yes. Wow, so good job. And also been a guest lecturer with UNC School of Nursing for both undergraduate and accelerated BSN nursing students. Yes. Great. And you have an RN, an MSN, and an OCN. Correct. And what's one thing that I left off, maybe something from your personal life?
Yeah, so if anyone knows me, I just had a baby in June.
Congratulations.
Thank you. So I'm just getting back from maternity leave.
Well, we are fortunate to get you back in your first week back. So thank you so much for being here with us. So without further ado, let's look at that Poll Everywhere poll. You can go ahead and respond to that. And these answers are anonymous, so go ahead and take a risk on this. Which of the following are examples of education standards and behaviors for nursing professional development? And we're already seeing a little bit of a trend here.
They've got it.
They've got it.
Yeah.
Okay. Well, congratulations. I can't promise they'll all be quite that easy, but a nice going, and we'll move on from there. So professional development and continuing education for oncology nurses with Claire Gillett. There's the keyboard.
Thank you.
And the mouse.
All right, wonderful. Well, thank you so much for having me here today. I'm looking forward to reviewing some of these concepts with you and talking about kind of what I'd like you to get out of this lecture. So first of all, I have no disclosures. I have no conflicts of interest related to this lecture. I'll be talking about some different websites and different resources, and just know I don't have anything to disclose regarding those. So here are our outcomes for this lecture today. I'd like you to be able to identify some electronic and written resources for meaningful oncology education. I want you to be a little bit more familiar with our education requirements at the organizational level. So for those of you who are joining here within the UNC system, I'm going to be talking a little bit about that, but then also at the state level. And then finally, let's talk about the significance and importance of nursing professional development, because really that's the why. So why is it so important to maintain your professional development as you move through your career? Okay, so let's just start with the why. So why do I have to develop professionally? Why do I have to do all these continuing education hours? So let's talk a little bit about what that means. So I brought the ANA scope and standards with me, and I wanted to highlight that one of the first standards that actually talks about why it is so important to maintain our professional development is in the ethics standard. So the registered nurse must maintain competence through continued personal and professional development. So it makes sense that ethically, to our patients, we do have to maintain that level of professional development. You'll also see that in Standard 12, which is the education standard, as a registered nurse, you do have to participate in ongoing educational activities related to nursing, and they also expect us to maintain a professional portfolio that provides evidence of individual competence and lifelong learning. So this is a pause point for you to say, do I have a professional portfolio? Is it updated? When was the last time I looked at it? Did you have to brush the dust off of it? So keeping a professional portfolio, something like this, can be extremely beneficial to you, and I do encourage you to do that. And according to the ANA, we should be doing that. So that's also something to keep in mind. Let's drill down a little bit further as to why it is so important to maintain our professional development. This is specific to UNC hospitals, but I wanted to share it. So for our entry-level nurse, the CN1 here, you can see we have a pretty robust education standards and behaviors. So with this, you are expected, even as an entry-level nurse, to develop goals related to professional development, participate in lifelong learning, attend education, and even provide education to your peers. As you move up in the clinical ladder, this expectation gets higher. So if you're from outside of UNC, you need to be aware of what the expectations are for your role. Because when you go to your annual review with your manager, you want to be able to say, this is how I'm meeting these education and standards. So let's talk about that annual review. It is that time of year. So if you want to receive the highest level here at UNC, on your annual review for education, you can see that for a clinical nurse 1, you're expected to have 15 education hours in a year. You're also expected to do a poster presentation and 1 hour of peer education. For a clinical nurse 2, moving up the ladder, that actually doubles to 30 hours to receive a 5, which is the highest level that you can receive, which is what we all want. What I'd like for you to take away from this is that you should really know the requirements for your position. It's really important for you to be aware when you walk into that review to say, here's what I've done over the past year and here's how I've achieved this, so that your manager can give you that highest level. Let's talk a little bit more about the why. So Oncology Nursing Society, a huge guiding force for what we do here in oncology. They issued a position statement called The Impact of Nursing Workforce Issues on Quality Cancer Care. And you can see that in this statement, they have said that both employers and the employees have to be dedicated to professional development. So from the employer side, we have to ensure that our oncology nurses are educated in the latest technologies and emerging cancer therapies on an ongoing basis. From the staff side of things, we're expected to validate our own competencies based on the entry-level competencies that ONS has defined. If you're not sure what those are, it's important that you become aware of what those competencies are so that you are making sure you're at the level you should be at. So ONS has even chimed in on what we should be doing from the educational side of things. Okay. So it looks like we've got our first question here. Which of the following is a reason to maintain continuing education as a nursing professional? Is it to meet the standards and behaviors of your job? To remain up to date on current research and literature in your field? Is it to maintain licensure, or is it all of the above?
All right, and we may have had a couple of answers bleed in from the last question.
Sure.
But if you'll take just another 20 seconds
Sure.
or so to go ahead and put in your answer. Thank you so much. I always think the lectures are that much better for the audience participation and everyone who is willing to share their answers to the questions. And for those of you who've been with us, you know that there'll be a Q&A portion at the end, and you'll be able to share your questions with Claire at that point.
Yeah. So they've got it. You know, in a way I could say that both C and D are correct. We do have to maintain our continuing education for licensure, but the answer here is D, all of the above. So we do have to maintain this for our standards and behaviors of our job. I reviewed a little bit about what we have at UNC. So this is your point that if you're not sure, I want you to find out, depending on where you work, so you know what those expectations are. We do want you to remain up to date on your current research and literature. ONS has said this is important. The ANA says this is important. This is how we provide quality care to our patients. And then finally, yes, licensure, very important. We all want to maintain our license. So yes, all of the above is the correct answer here. Okay, so let's talk a little bit about the state level here. What are the expectations here in the state of North Carolina, and what are some resources that are going to be available to you? So I get a lot of questions about North Carolina licensure. I'm always going to refer you to the Board of Nursing website. So what I've provided here is current as of right now. I would always direct you directly to their website or give them a call if you have any questions, and they can help assist you with that. Let's talk about some of the basics. So I get a lot of questions from folks who are doing this for the first time. So some of this might seem a little simple, but still I think it's good to review it. So licenses must be renewed by the last day of your birth month, and they are valid for 2 years. I find it helpful to just mark my calendar so that I know each year when my license is going to be due for renewal. Just recently, the Board of Nursing has created this NurseSys e-Notify system where you can actually get an automated license and discipline notification. You can choose either to receive that via text message, via email, or both. I would encourage you to sign up for that. I find that to be very helpful, again, in marking my calendar and making sure I'm aware when my licensure is due, and it's just a good way to stay on top of everything. So when you're ready to renew, when it's time, you have to set up this profile in what they call the Nurse Gateway. I do like to highlight that there is a fee for renewal. Again, just keeping that in mind, that ahead of time there is going to be a fee. And here are requirements for North Carolina. You have to have an active license. It has to be within 90 days of expiration. I get a lot of questions about compact states, so you can't declare another compact state as your primary residence. And then the biggest question that we get is about this continuing competence requirements. So a big source of anxiety for all of us. So how do I meet these continuing competence requirements when I'm getting ready to renew my license? The majority of folks that I work with use this top line here. 15 hours of continuing education and 640 hours of active practice within the previous 2 years. Now you can see there are other options listed below. You can have a national certification. You can do 30 hours of CEs. You can take this refresher course. So there are other options available to you. I just want you to be aware that the Board of Nursing has these available to you, and only one of them is required. So don't look at this list and feel like, oh my gosh, I have to achieve all of those. It's just one. Sometimes people say, gosh, is it possible that I'm going to have 640 hours of active practice within the last 2 years? Yes, the majority of people do. So that pans out to about 6 hours a week. So if you're working full time, this is absolutely going to work out for you that you've had that amount of practice within the last 2 years. Audits. So again, source of anxiety. A lot of folks worry, oh my gosh, am I going to get audited by the Board of Nursing? It's random. So if you happen to be randomly selected for audit notification, you will receive that via mail when your renewal notification is sent out to you. So it is really important that your address is correct with the Board of Nursing so that if you are audited that you do receive that notification. The good thing is that for those continuing competence requirements, you only have to submit evidence of those if you're audited. So don't feel like when you're submitting your renewal that you have to show, here are my hours, here's how I'm achieving that. Just know that if you are audited, that is going to be expected of you. So it is so, so important to keep track of that. When you renew online, you will also be told if you are being randomly audited. Again, random. So we've had folks renewing for the first time be audited, and then folks who have not been audited. It truly is random, but just be aware that it could happen. And if it does, that's when you're going to have to submit your proof of your continuing education. So some tools to help you. I think that signing up for the Notify system is helpful. I went ahead and signed up myself so I can have those extra notifications. Go ahead and set up that gateway account ahead of time so you don't have to scramble to do that. Decide early on in your cycle how you want to document your continuing competence. Do I want to do 15 hours of CEs? Do I want to do 30? Am I looking to get my certification this year? And that would help me. Keep track of all your CEs. So this means keeping your certificates either electronically or keeping them in that professional portfolio. That's going to be extremely important. It's so hard to track those down after the fact. And if you don't have them, oftentimes they're not going to be able to accept any proof. You have to have proof to say this is what I did attend and this is how I achieved those continuing education hours. Mark your calendar. It sounds really simple, but again, it's not going to be creeping up on you as to when your license expires, and be aware of that fee. And then again, make sure your address is up to date with the Board of Nursing so that in that instance, if you are audited, you know ahead of time when you are getting ready to renew, and you can have all your paperwork ready when that does occur. So some tools to help you. Again, always I'm going to refer you to the Board of Nursing website for the most updated information. Again, you can call them and also ask questions of the Board of Nursing directly and reach out to them for any specific questions as well. Some other statewide resources that I wanted to share, thinking about folks outside of maybe the UNC system that you might not be aware of. If you've not heard of the NCAHEC, so the Area Health Education Centers, as a resident of North Carolina, you're going to have some access to continuing professional development programs. This includes folks outside of nursing, so you can see physicians, dentists, pharmacy staff in the hospital to receive affordable training in continuing education to help keep you up to date on what's going on with emerging therapies and advancements in these fields. I went to their site, I typed in oncology. Here are 6 offerings that are coming up in the area. You can see some of them are maybe a little bit further away than the triangle, but you can see they have availability to either read more or to register. For these, you can see that listed here on the screen. So there's just a couple resources. I see a certification review course, a symposium, so just some things that you can be aware of that are available via the AHECs. And we're going to roll into a question. So how often must a nursing license in the state of North Carolina be renewed? Yes, you got it. So wouldn't it be nice if it was every 10 years? But it's every 2 years, so perfect. Very good. Okay. So now we're going to talk just a little bit about some standards and expectations here at UNC. For those of you who are viewing outside of UNC, I'm going to encourage you to get to know your educator. So do you know who your service line educator is or your unit educator? Do you have a clinical nurse specialist that you work with that could help you with your continuing education? Do you know where your education department is? These are all things to consider so that you can have the resources available to you for your professional development. I'm going to talk about some of the resources here, but I do encourage you to know what the expectations are in your role and know what your resources are at your institution. So we'll talk a little bit about continuing education. We'll talk a little bit about professional certifications and why those are important, and some oncology resources. So for those of you within the UNC system, we do use our LMS, our learning management system, to upload all of our classes. So right around this time of the year, we're going to be uploading all of our oncology classes for the entire year. I speak for oncology when I say if you are a pharmacist, or if you're a massage therapist, or if you are a discipline outside of nursing and you want to come to some of our oncology offerings, we would encourage you to reach out to us to see if there are seats available where you could come and join us. We would love to have you. We would love to have you join us. So if you're interested in receiving CNEs, you can actually just type in CNE within LMS and it's going to pull up all the offerings that currently have CNEs. You can see I typed in CNE oncology and it pulled up about 105 results. Some of those might be a little outdated, but we do have plenty of up-to-date oncology CNE classes that are available to you. Our offerings are here right on campus in the nursing education department. We're happy to help you with directions and help you getting over to where we're at. And we really try and make these classes enjoyable for you as the staff member who's attending. So this is one great option. I think UNC does a fantastic job of offering CNEs to staff members for free, which I think is wonderful. Let's say you're interested in doing some self-paced learning. So you think, you know what, I work nights, coming in for class just doesn't work for me, but I still have to get those CEs for my license, or I have to get them for my professional development. You can gain access to CE Direct working here at UNC. So this is access to self-paced classes, and they do have an oncology curriculum. They have a certification review. Let's say you're really, really interested in getting your OCN. They actually have a very robust certification review with lots of resources that you can enroll in, and a focused CE series. You can get CNE credit for that as well. Now with this is self-paced, so you're not going to have the interaction of the instructor. But if you're someone that does well with the self-paced activities, if you're someone that does well with slides and Q&A, this would be a great option for you. The licenses will be granted to you for a certain period of time, and then that license will be given to someone else. Now, if you need it back after that period of time, you can request it again and get re-access to CE Direct. I've gotten access a couple times to take a few classes, and then my license expires, and then they go ahead and renew it for me when I need to log back in. So I've left the email address there if you have any questions. There are some courses in there that are for outside of nursing as well. So just email them and they can help identify whether or not they can grant you a license and for how long you can have that for and what classes are available. Let's talk a little bit about the Oncology Nursing Society website. So if you've been to any of our classes in oncology, we've probably taken you here. There is a wealth of resources available here to you on this site. You may be thinking, gosh, I have to be a member in order to gain access to these, and for most of them you actually don't. So you can see on their resources, you can see they have it arranged by Explore by Goal, Explore by Topic, or Explore by Source. I love to read their articles and look at their assessment tools, and I'll show you one other page that I really like to go to here on the ONS webpage. If you are a member of ONS, which I'll talk about a little bit later on, you'll have even more access to lots and lots of resources, including some discussion boards, which we'll look at here in a little bit as well. But I do encourage you to explore this site, take a look around, and get familiar with what's here. There's a wealth of resources right at your fingertips, and a lot of it is free. If you do become a member of the Oncology Nursing Society, you'll get access to the 2 journals that they author. So the Clinical Journal of Oncology Nursing as well as Oncology Nursing Forum. You'll get these in hard copy delivered to your home address, and you'll also receive electronic access when you log in. This, I think, is a fantastic way to maintain your knowledge and your professional development. Slide these in your bag, and when you're riding the bus, take them out and read an article, as simple as that sounds, and write it down. Then when you go to your annual evaluation with your manager, you have a list of 15 articles that you've read, and you say, wow, look at this professional development that I have done over the past year, and it was right there at your fingertips. There are CNEs available for some of the articles in each of these journals, and I really do encourage you, if you're interested in taking a look at those. I know we do have some leaders who also provide these to their units. They'll kind of leave them in the break room, in the conference room, so you could take a look at them there. If you ever have interest in a particular article and you're not a member, feel free to reach out to me, and I'm happy to lend you a magazine so you get a chance to look at that. This is the symptom intervention page through Oncology Nursing Society. This is one of my favorite resources. If you've been to chemo class with myself and my colleague, you've had a chance to see these. So for various symptoms regarding oncology patients, they have actually collated literature and arranged that literature by evidence. So they say, here's what we recommend for practice based on the evidence. Here's what's not been established as effective, and here is not likely to be helpful for these certain symptom interventions. So the one I've pulled up here is caregiver strain and burden. They have a symptom intervention page for fatigue, for nausea, peripheral neuropathy. So if your patient is struggling with, say, peripheral neuropathy, and they say to you, well, I read online that mistletoe oil could potentially help with my peripheral neuropathy, you could actually go to the symptom intervention page through ONS, and they may have an article there. They may be able to tell you, is this likely to be effective? Is the effectiveness not established yet? Or is it down in that red column where they say this is not something that is recommended for this particular symptom? I do encourage you to take a look at these. When you click on the hyperlinks that are right here, that will actually take you to different articles that ONS has pulled together. And if you're a member, you'll have access to read those articles in full. So extremely helpful information that is available to you. If you're not a member, you can still look at the page and still get an idea of what's recommended and what might not be recommended. So again, this is called the Symptom Intervention Pages through Oncology Nursing Society. Free, right? We love things that are free. So free CNE, you don't have to be a member of ONS. So if you go to Get CNE and go to courses through ONS, as of right now, when I pulled this screenshot, they had 6 free classes. You don't have to be a member to get those. So you can see I've pulled kind of the first 2 that are up there. They're not going to be available indefinitely. So if you see something that interests you, take it. It might be a half hour of CE, it might be an hour, but I do encourage you to take those when you see the ones that you're interested in, because they may not be there in a couple months. So again, free CNE available to you. Here is the ONS discussion board. If you're a member of Oncology Nursing Society, this is something that you would have access to. What's really neat about this is this links up oncology nurses internationally. So let's say you have a practice question that you really want to gain some insight on, maybe from some other institutions. You can post your question here and get insight and input from other oncology nurses all over the world. So I've posted queries here many times to get input from other folks. If you have a query that you're interested in, perhaps for a project, a new grad project, or you're just curious and you can frame up that question for me, I'd be happy to post it for you if you're not a member. You may get a lot of responses depending on the topic. You may not get as many, but it really just depends, but it is a great place to even just go peruse topics. I like to log on and just kind of see what other folks are talking about to stay up to date on what's going on in oncology nursing kind of internationally. So you can see some of the questions people have posed here. Someone just asked a question about ports, methotrexate levels, compassion fatigue. So things that we're talking about all the time, and you can hear what other institutions are doing and even get some literature on that as well. So if you are interested in being a member, I've linked up the ONS membership site here. There is a local chapter as well, the Triangle ONS. So if you're interested, I've provided their email address too. Again, it's completely up to you as to whether or not you'd like to be a member. I found it to be very beneficial in my career. I do love receiving the journals, even though I don't always have the time to read them, but I do slip them in my bag, bring them with me, and even just reading an article here and there can really help you stay up to date on what's going on. So when I'm talking about continuing education, I have to mention the learning portal. I'm a site coordinator, so oftentimes I'm the one who's sending out the reminder emails for these lectures. I myself have taken many of the online courses that are available in here and attended the live events. So if you're viewing, likely you do have access to the portal. If you don't, I highly encourage that you do. Gain access, get into the course catalog. I've even, had folks, we've pulled up some of these lectures when we've been together and viewed them together in a class. So I definitely encourage you to gain access to this. You can see that I'm actually currently enrolled in a course that I need to finish listed here. So again, I think you said about 24 classes are loaded up right now.
That's right. So at any given time,
Yeah.
we have about 24 courses that are there
Yes.
because we do 24 live courses.
Yes.
And then within a couple of weeks of the live course, we've turned that into one of the SPOCs. We call them self-paced online
Perfect.
courses. So, yeah.
So definitely encourage you to join in on that, especially if you can't view a certain lecture. I know before we had the portal, I had a lot of folks emailing me saying, gosh, I missed it. Can I view it? And now they can.
And we really tried to listen to that because
Yes.
we heard a lot of that, or gosh, I just can't make it
Yes.
at noon on a Wednesday. Is there any way? And of course, we've always had the recordings, but now with the technology in place in that learning portal, and we'll have those there for a year. I do want to note that we wish we could keep them there indefinitely, but the regulations we need to follow and mean that they have a shelf life of one active year, and so you can see the dates on there too and determine if there's one that's on there that isn't going to last for more than a month and a half or whatever, take that one before it does expire.
Yes.
And then everything, we've got literally hundreds of lectures that are in our library in the event that you do want to watch something and the credit has expired on that.
Yeah. So I definitely encourage you to take a look at those. And when you do view them after the fact, you will be, expected to do the learning assessment. And that is just a way to validate that you are, in fact, viewing and getting something out of that lecture. So I do encourage you to do that. Okay, so we know about the telehealth lectures. That's where we're at right now, every other Wednesday. So site coordinators such as myself, we send out the reminders. You can join virtually, as you know, or watch at a viewing site. You do have to complete the evaluation, and you can earn credit after that as well. Those archive lectures, you do have to create an account, view the lecture, take that knowledge assessment, and print certificates, and you can see the different courses that are listed here as well.
And I'll just put in a plug. We used to have people say, gosh, well, I think I took a course back so-and-so at such and such a time, and can you help me find that? And what's really nice about this learning portal is they're all stored there for you. So even after the course is no longer available for credit, those certificates are there, and you can go ahead and download those a year later or a year and a half later. You'll find those are available.
So helpful. And thinking again about developing that portfolio for your professional development, you want those certificates in here. Again, if you get audited by the Board of Nursing, you want them in your portfolio ready to scan in and send to them. So having them available after the fact is just great.
Good.
Yes.
Good. And we'll try not to sound like an infomercial for UNC Cancer Network's learning portal, but I'm glad the topic came up.
Yes, absolutely. Good. Yes, it's a resource that I've used. I direct a lot of our new graduate nurses to it because I feel like we're a sponge, right? We just want to learn. So I encourage folks to really become a part of that. Thinking about your professional development again, what about perhaps pursuing a professional certification? So do you want to become an oncology certified nurse? Do you work in bone marrow and you want to become a BMT certified nurse or pediatrics? At UNC, we have a great benefit of potentially you could be a part of our no upfront fee program. So applying for certification is costly and taking the exam, and having the no upfront fee program in place is a way to alleviate some of that anxiety of taking that exam so that you don't have to pay unless you pass. So that's very, very helpful. So again, if you're thinking about a specialty certification, OCN, BMTCN, or the pediatric, I highly encourage you to do so. I will say that it used to be you had to have about a year of practice for OCN, and they've recently changed that to 2 years of practice. So we had a couple folks kind of slide in right at their first year, right before they changed that. But just know that you do have to be an oncology nurse for about 2 years before you apply for the OCN now. So that was a recent change that I wanted to make sure I highlighted. So why? Certification makes a difference. So your patients, when they might see it on your badge, they might ask, what does that mean? And you can talk to them about what OCN is and what you had to do and the studying that you did for the exam. It's a way to be more than your RN licensure. So you saw when we looked at the continuing competence requirements, that is one way to achieve your continuing competence for your licensure, but it's more than just achieving your licensure. Your patients are going to value it again, so when they see that on your badge, they're going to ask you about it and want to know what that means and what that means for you. Know that you're dedicated to oncology. It helps you to grow, and it benefits our employers as well. So if it's something you're interested in, feel free to email me. We also have a great committee regarding professional certifications here. I'd be happy to direct you to some of their resources. We have a lending library over in nursing education that has some review resources, review books, if you're interested in checking some of those out as well. And I'd be happy to help direct you to some of those resources. So do consider it. I do encourage it. I think it's fantastic. Let's talk a little bit more about oncology resources that are available to you, thinking about what do you want to just soak up. So this is our Oncology Courses SharePoint site. So if you're enrolled in, say, Oncology Core, so let's say you signed up, you're going to be coming to Oncology Core, you will gain access to this site prior to your class, and you'll enter the Oncology Core page. You'll have access to the slide decks, the agenda, and you'll have access to those materials after the class as well. So thinking about if you're someone that likes to take notes on your laptop, you can bring your laptop to class, you can bring your iPad, whatever you would prefer, so that you can have access to those slides electronically. And again, they are available after the fact as well. You can see we also offer that for our BMT core class, our chemo class, and then our review classes as well. So this is an open site, but again, if you do register for one of these classes listed here in LMS, they'll actually send you an automated reminder email about 5 days prior to class with the link to the site and directions as to how to get there and download the materials. So that's just one kind of extra resource for you. This is a look at the Oncology Core page. So we'll soon be switching over to the 2020 flyer, but you can see we have our dates listed, how to register in LMS, and then what you can't really see on this page on the other side is the slide deck. So each presenter, we would load up their slide deck, have it there available to you for download, for taking notes in class, or you could access it after the fact as well. We do just ask that, those are the property of the presenter, so we ask that you don't distribute or edit those in any way. What we've also been adding on the Oncology SharePoint site is educational resources by disease group. So let's say you're going to be working with primarily hematology oncology patients. When you would click on the Hem-Oncology box, it's actually going to take you to some resources we've collated. Most of them are online resources for that particular topic. So we're currently developing this and trying to grow into the different disciplines. So right now we have Hem-Oncology and breast oncology updated, and I can show you a screenshot of that. And then over time, my goal is to grow all of these so that we have this online library of resources available to you. Again, this is a free, open site available to you to access and take a look at what some of the resources are. So here's a look at the Heme Oncology page. You can see I've linked some online CNE through NCCN. Those are some free classes that are available to you. I also linked some classes through ONS that are available. Again, some of them might only be half of a credit hour, but still that adds up, and it might be on a topic that you really want to learn something about. On the resource library, I've loaded up some slide decks that we have from Oncology Core regarding these specific topics. So you could, if you want to flip through some slides, or let's say you came to class and you want to just reference those again, those would be available to you there. And then I've also linked to the learning portal. So I've linked to the lectures available in the learning portal. So if you want to watch a lecture, I've provided some hyperlinks on the side there that you could actually get to those that way. It does require some maintenance and upkeep, and that I do have to check we do have to check our links and make sure that everything's still working, and they do have to be updated. So this is a living page. It's a page that is constantly evolving. Okay. Quick question. True or false, most resources or classes needed to maintain certification and or licensure are fee-based? Yeah.
I think they've been listening.
I think so. So again, I just want to encourage you, don't feel like you have to go out and pay for a bunch of CEs. I know I personally have been in a situation where I had to get some CEs pretty quickly, and I've gone out and maybe purchased a class before. There are so many resources available to you that are free. I hope I've collated some of them for you that you could go poke around and see what's available. But honestly, we have a lot that are free. All right. So continuing education and professional development are essential to the RN role, even at the entry level. So again, we looked at that entry level for nursing, and you saw that continuing education is an expectation even when you're right out of school. I know that's hard. I know that you've just finished school and you think, gosh, I don't want to have to read another reference article again, but it is something that's really, really important to us at the entry level. So again, if you work here at UNC, we looked at what those requirements are. If you don't work here, then I want you to learn what the requirements are for your job, so that again, when you go into that review, you can say, here is what I've done, and I've done a fantastic job. There are so many resources available to you, both in and out of the UNC system, and again, so many of them are free. And I'd be happy to help you find those. Just let me know. If you're not sure where to find a resource, so I've listed myself and my colleague Susie here. We're happy to help you. Again, if you're outside of our system, I'd love for you to find out who your educator is. Who is your point person for this? Is it a unit-based educator? Is it your clinical nurse 4? Is it a CNS, a clinical nurse specialist? Do you have an education department? Do you have a lending library where you work? Can you go check out books? Those are things that are really, really important. Another resource I'll just mention really quickly that I think is really helpful is using the Health Science Library here at UNC. I have a tip sheet I'd be happy to share with you about getting that set up so that you can access reference articles that way. And I do encourage you to do that as well. So again, it's important. The ANA says we've got to maintain our professional development. ONS has said it's so, so important. And it's important for your licensure as well. So I hope this has given you some food for thought, a little bit more about the why this really does matter. It's not just a box that you're checking off every 2 years, so that you can continue your professional development throughout your career. And again, for those of you outside of the system here, get to know your educator. We are here to help you, and we'd love to do so. So, yeah.
Claire, thank you so much. This is a great presentation. So we are fortunate in that we have some time for questions. So very nice.
I always like to provide some encouragement at the end there.
Absolutely.
Yeah.
So for anyone who missed it at the beginning, you can go to polev.com/UNCCN, and you'll now see a place where you can go ahead and type in your questions. So please go ahead and share your questions with Claire. If you prefer to use use texting. Text, if you didn't already earlier, UNCCN, those letters to the number 22333 once to join, and then you can share your questions that way. While we are waiting for our audience members to share their questions, I have a few.
Sure.
Well, first off, I wanted to thank you for being a site coordinator. So that is terrific. And if we have anyone out there who's interested in being a site coordinator, please let us know. If you don't feel like you have somebody at your site who's helping to make the UNC Cancer Network lectures available, let us know. We'd love to help you out with that. Similarly, we have a role called a promoter, and we have a lot of folks out there, and I'm sure some of them are listening, who simply agree to share out information on their various mailing lists, etc., and we are very appreciative of that. And if you're not already doing that and would like to, let us know. It's easy. We'll make you a promoter. We'll send you some extra materials to forward on. All right, we've got questions. What is considered an active nurse by the Board of Nursing?
That's a great question. So this is a question I would, if you have questions about your practice, if you're not sure if you would qualify as an active nurse, then I would definitely recommend reaching out to the Board of Nursing. They don't have it very, laid out there very specifically. So I would refer you to them if you're questioning, am I an active nurse, am I not? For me, when I was working on the unit, on the floor in the clinic, that was my patient care hours, my active nursing hours. But if you have questions, I would always refer to the Board of Nursing.
Great.
Because they're our number one contact for that.
Great, great, thank you.
Yeah.
How do we get CE credit for the class? I'm assuming for this class.
Sure.
So for this class, there are a few different ways. If you are with a coordinator in a room, that coordinator will get you the information so that you can claim your credit online. If you registered through Zoom, you can go ahead and you'll receive, if you've attended at least 50 minutes of this, you'll receive information so that you can claim your credit. And in the event that you're watching this and didn't do either of those things, you can go to learn.unccn.org, and in just a couple of weeks, this course will show up with all of the other courses. You can go ahead and you don't even need to watch it since you've already watched it. Just go take the assessment to prove that you know the material that was presented, and then you'll be able to claim your credit that way. And that's all free, and you just create a free account to do that. Anything you want to add to that?
That sounds great. Yes.
Oh, okay.
Yes.
Can a nurse navigator meet the eligibility criteria to sit for the OCN exam?
Yes, and we have many navigators who have taken their OCN while they've been here. Come to our review class. We'd love to have you for our certification review class. Yes, as of right now, that is true. So we would love to have you in our review classes, and I encourage you to obtain that certification. Yeah.
These are great questions.
They
Keep them
are.
coming.
Yes.
If we are outside the UNC network, how do we obtain the CNE for the presentation? Well, the good news is that UNC Cancer Network is freely available to all relevant professionals with the certifications we offer. So you can go ahead and, again, go to our website, unccn.org, to find out about the future ones, or to learn.unccn.org, which is also connected to from that main site, and go ahead and take the test, or if you signed up with Zoom, receive the credit that way.
Wonderful.
Let's see. Can Nurse Navigator meet the criteria for the OCN exam?
Yep.
All right. Thank you. Very helpful information.
Good.
I agree.
I'm glad.
What is the website for the CE credit again? So for unccn.org is our main site, and from there you can go to you can either navigate from there to our learning portal and just click on the link, or you can go to learn.unccn.org. Either way. All right. We still have time for a few more questions, and while we're waiting for those, and this may just reflect my ignorance not being a nurse, but what is a compact state?
Sure. So you can have a nursing license in another state and practice in North Carolina.
Okay.
So a good example I can give you is when I moved here from Virginia. Virginia is a compact state.
Okay.
You can have that license in Virginia and still practice in North Carolina because they're part of a compact.
Okay.
Now, if you're going to move here permanently, which is what most of us do, you will switch it over to your North Carolina license because you have to have that permanent residence here in North Carolina when you get ready to renew. But there's many compact states. Again, I'd refer you to their website. across the nation where you can practice in different states and just keep one license. So if you're interested in travel nursing or something like that, get your license in a compact state so you can go to all those different places.
Great,
Yeah.
thank you.
Yeah.
Let's see. I had a few others. Let's see. You talked about so AHEC. Are all of the courses on AHEC free, or do some of those have costs?
Some of them do have costs affiliated with them.
Okay.
Yes.
Okay.
Yeah.
And that does go beyond oncology nursing as
Yes.
well. So it's got
Yes.
a variety
Yep.
of different. Any idea what the costs are associated with
You
that?
know, I'll be honest with you, I didn't look too closely at the cost there, but I did see some were free, but some did have a fee associated with them.
Okay.
Yeah.
And with LMS, are all of those free?
So if you're a UNC employee and you're coming to a class here at UNC, we don't have a fee associated with those. So if you're finding a class in LMS, you're a staff member at the hospital, those classes should be free to you.
Okay. And are those live only, or are those self-paced as
We
well?
mostly offer live.
Okay.
There are a few self-paced courses available in LMS, but majority of those are going to be face-to-face.
Okay, great. And CE Direct, is that free, cost,
So we do have licenses through UNC. So if you're a UNC employee, majority of UNC employees are going to be able to access those for free.
Great, great. And then ONS, for those courses, any idea what a membership costs?
It's about $100.
Okay, annually
Yes.
for that. Okay. And does that then entitle the member to free access to all courses?
Yeah.
Okay.
Yes.
Okay, great.
Yeah.
And another question I had, are there, there may be a situation where somebody really wants to find out about a topic that isn't available through any of these free resources. What are some of the other commercial resources that are out there, and what is one likely to, and maybe what are some of the ones that you think are really reliable, good, well-designed courses, and what is one looking at spending for that?
So, I mean, majority, again, I'd say that we use are free, which I think is a good thing. Through the Board of Nursing, they do offer some offerings for fee through them to achieve your CE, so that might be one option. I would say a lot of oncology nurses ask me about different therapies and treatments, and they want to learn more about those. I would encourage you to go to websites like chemocare.com, which is free. That has a lot of resources available to specific drugs, which is fantastic. So that's another option as well. And again, if you're not a member of ONS, you can still have access to some of those classes, and they would potentially be fee-based. So it would just depend on the class, the number of credit hours. I've seen some that are, $100 or so up to more than that. So it just depends on the class and the number of credit hours that they're offering. I can also mention too that, our conferences that are available through the Nursing Professional Development Department, those will sometimes have a fee associated with them as well, just depending on the conference and the number of CEs that they're offering. But sometimes you can get reimbursed depending on your job.
Okay, good. And I see a question, could you post all the links used for this presentation? And the answer is absolutely yes. So Claire has made the presentation available to us in a PDF format, and we'll have that available on our site as part of the as part of what goes on the web after the presentation. And it's actually there now. You can even navigate to unccn.org, and there where the registration and information about the presentation is, you'll also find that presentation. If for any reason you have trouble finding any resources associated with this or any other lecture, you can contact us 919-445-1000 or unccn@unc.edu, and we will be happy to help you with that. Thank you all so much for all the great questions. Let me see, there are a few other things I needed to go over before we finish up. We want to thank the North Carolina General Assembly for their generous support of the University Cancer Research Fund and the UNC Lineberger Comprehensive Cancer Center, which in turn make this series possible. I want to specifically call out Mary King, Veneranda Obore, and John Powell for all the hard work they do for this and every one of the lectures in our series. This is our RN and Allied Health series. We also have our MedSurg series, and that does have every one of those lectures has a CNE associated with it as well. And we also have a community college series, and we're very excited to be starting the next year of that. So we'll have 4 different courses there. So if you know any community college instructors, if you are a community college instructor, if you know community college students who are in allied healthcare fields, this is a great opportunity to share that information with them, and we're excited to start that coming up soon. We have more lectures. Our next lecture, September 25th, Cardiotoxicity and New Therapies with Dr. Jensen. Then on October 9th, our next RN and Allied Health lecture, Working with Patients Through Interpreter Services with Miriam Peerboom. So those are coming up soon. And then we have self-paced courses, as we talked about. All of these courses come online as self-paced courses. So the newest available courses available until August 13th of next year, Helping Patients with Breast Cancer with Catherine Harrell, and Decision Making in Metastatic Breast Cancer with Dr. Lisa Carey. So those are both newly available. Also, Radiation Oncology 101 with Jane Camporial and Mary Fleming Knowles, and Improving Outcomes in Radical Cystectomy with Dr. Raj Pruthi. So lots of new courses available. Cancer Conversations, one more series. This is not for credit. This is for the general public. And September 27th, Does Prostate Cancer Screening Save Lives with Mary Dunn, and Living Well with Breast Cancer with Dr. Crystalline Gallagher. So those are coming up soon. We want to thank our audience. As always, we think the world of you and really appreciate your being here for this and other lectures. Questions, again, email unccn@unc.edu, 919-445-1000. We're at unccn.org. And Claire, thank you so much. This has been great. We really, really appreciate it.
Thank you.
And until next time, thanks so much.